Okay, today we want to share the experiences of one of our patients who have a varicocele surgery. You have bilateral surgery, right and
That's
left-sided bilateral surgery. And it is, of course, very important how the recovery is. We don't see our patients usually when we operate them from who are coming from other countries. We operate and they go away.
They go home.
We are in touch. We have text messages, phone calls, and they say, okay, we are normal, and they disappear.
Yeah.
So you had the chance of, you have some by passing by through Istanbul, and you stay here for a day, and we see you now. So I want to get your experiences just after the surgery. How was the first days? Because you have bilateral surgery, it means you have double surgery.
Right.
2 times left-sided varicocele.
Yeah.
That means recovery will be a little more difficult and more tricky.
Right.
So when you stay one night at the hotel, hospital, you stay one night at the hospital.
Yeah.
How was it? Was it painful? How was it?
There is some pain when you move, like in the bed, but the pain wasn't terrible for what I thought. Obviously, they're giving you some painkiller anyway. But you've had surgery, so you also have a wound. People might think it's the testicles will be really sore, but probably the wound where when you move your body where the wound is you might actually feel more there than the testicles. But it wasn't. In my experience, it wasn't too bad. Okay, so next day
we send you to hotel, and we will prescribe 1 antibiotic and 1 painkiller. You use them regularly, right?
Yes, I did.
How many days did you need the painkillers especially?
I'm trying to remember, but I think the painkillers I maybe took for only 3 or 4 days.
Yeah.
The prescription was for longer, but then I feel like I didn't need, because you take a painkiller and then once the painkiller starts to wear off, you can feel how much pain there actually is. And in my experience, after 3 days or something like that, it wasn't that bad.
And what was the time you left the country? How many days you stayed at that time?
I think we did the surgery on a Tuesday and I left on Saturday.
Yeah, so 4 days you stay here at the hotel.
Yeah.
And do you
I think I could have left the day before.
How many days is good enough for waiting?
I think 3 days would be good.
Yeah, 3 days. But we usually operate on Monday or Tuesday.
Right.
And we ask the patient to stay until Saturday to be more safe.
Yeah, I think it made sense. Like I was glad that I stayed until Saturday, but in terms of how I felt, I could have probably left on Friday if I needed to.
Maybe Friday, yes. If it is too much urgency to go back immediately, it may be Friday. Of course, it's possible.
But I would recommend people, if they have the extra day, it's worth it, so that you're feeling more better by the time you have to travel.
And remember, you had 2 surgeries, right and left side. When they have left-sided, it's a little more easier, quicker to recover. But of course, it's safe to stay as long as possible. And when you go back, how was the trip? How do you feel during the airport walking? You have to walk at the airport.
That's right. Yeah, I think by that day I didn't feel bad. I didn't have any discomfort really from walking. I mean, I wasn't running around, but there was no pain from just walking or from sitting down on the airplane. It was fine.
And when you go home, what's the first time you feel okay, it's over, and you begin to forget about the surgery? You feel comfortable, confident enough?
Well, I would say in terms of being confident to kind of like move around more freely, it's maybe like a month. But I also, before the surgery, was like, I had questions about when can I start exercising again. I would say you want to wait, especially for anything involving intra-abdominal pressure. You need to wait for several months before you're doing anything like that. But you can start being active quite soon, I would say, after the surgery. As long as it's relaxed, you
Yes.
can walk, and maybe you can go swimming after a month or something like that.
Yeah.
So
For work, what's your
work is not physical for me. It's just at a computer. So work was
so if
no,
it is
no
a
problem.
table work, they have to go to their work and sit on the table and work.
Right.
Usually the jobs are like this nowadays.
Yes.
And usually people in Turkey, they say 5 days is enough. If they have to go, they can go in 5 days.
Right.
Do you agree?
I would say so. Yeah. I mean, within 5 days, I was sitting down, no problem. Like in terms of it wouldn't have been discomfort to work at a desk.
Now it has been 9 months, right?
So it was January, and now is November. So it's been 10 months.
10
actually,
months now. And did you start exercising?
Yes, I did. I started exercising after about 4 months in terms of more like serious exercise, but lighter exercise I was doing before that.
Yeah. And what's your recommendation for lighter exercises?
I think swimming. So I did some
1 month.
swimming. I felt okay. I don't think I went swimming after 1 month, but I feel like I could have. As long as it's like again, you're not really pushing it. You're just taking things easy.
To be honest, my worst enemy is exercising.
Yeah,
so we have to be very careful, and also you can feel yourself when you feel the scrotum free of the veins. It's empty.
Yeah,
you can push more.
Right.
But if you still feel there are large veins, there's a potential of having recurrence. So you have to be more careful. Of course, the best is looking with Doppler. Now I look with ultrasonography, and all is clean for you. You can do whatever you want.
Right.
So for exercising, you are free of doing anything.
Yeah.
How about the sexual life? How it started, when it started, and did you feel any discomfort?
Yeah. So I think I after the surgery, or just before, I asked you, how long should I wait before?
We usually say 15 days, 2 weeks.
Yeah.
Is it a rule? No. Who created that rule? Nobody.
Right.
But
there's no studies.
With experiences, yes, there's no studies like this. Once I let one of my patients, you can do whatever you want, and he had too much edema, swelling in the first week.
Yeah.
So 2 weeks.
Yeah, I think I waited then at least 2 weeks, but not more than a month, but there was no discomfort.
Yeah, during ejaculation, such things you do not have discomfort.
Yeah, none at all.
So varicocele surgery is easy surgery, as you faced now. It doesn't alter your way of life. It doesn't make too much changes in the way of life. And after a couple of weeks, you start to feel very comfortable.
Yeah.
After a couple of months, you totally forget about surgery.
Yeah.
Do you agree?
I totally agree. It was after a month, you won't be feeling any discomfort, I would say, in day-to-day life, unless you do something wrong.
Yeah.
You sit down.
Something wrong?
Or you sit down wrong, or you turn over very quickly in bed, and maybe you hit your own testicles in the wrong. Then you could feel something like, oh, they're still healing a bit, but not in day-to-day life. And then after a few months, in my experience, you forget about it, because there's nothing to feel anymore.
No signals, no irritation.
Yeah. So when you ask me before, when did you stop, feeling anything? It's hard for me to know, because you just forget about it after a few months when you stop feeling it.
Yeah, but you can say after 10 months, at some point you start to completely forget about it.
Yeah, and it was definitely within the first 4 or 5 months that I never felt anything more.
Sometimes varicocele surgery increases the morning erections and libido and erectile quality. But if the patient has no complaint like this, it doesn't make any change. Did you feel anything such change?
I didn't feel any changes there. But I didn't. same before and same after. So I didn't have a problem before. So
some of the patients, these veins cause too much drainage of the penile blood,
right,
and they have too much erectile quality loss.
right.
And after varicocele, it's corrected quickly.
Right.
But if everything was normal, there is no change, of
Yeah.
course. Okay, so these are all questions I can now come to my mind. Do you have anything to add?
No, I'm just glad that I got the chance to come back, because I think it's, even if people, obviously, you don't need to come back to Istanbul to do this, but if people can get like a Doppler ultrasound,
Yes.
you know, at a time, a certain amount of months
Yeah.
after to check on things, I think that's probably a good idea. For me, it just so happened I was coming through Istanbul and I could.
Yeah, this is
come
what
back.
we do. We ask for Doppler ultrasonography.
Yeah.
If they will not come, they do the test in their country and send it to me.
Right.
This is the way. Thank you very much.
Okay, thank you.
Thank you. Have a nice trip.